Good evening, dear friends. Hello! It's Friday, which means our favorite YouTube almanac is on your YouTube screens. And today's topic, which has been fascinating many people for many centuries. What is numbing? What is it? Blood circulation disorder? What to do? Should you worry? Where to run? What to do? Today, we will figure out with you why fingers get numb, why the arms get numb, why the whole hand gets numb, what to do with it, whether to worry or just forget about it. So, friends, how is our body structured? Our body is a complex biological system where different parts of the body are connected to each other like wires of the nervous system. Wherever you go, the nervous system gets there. When we want to do something like raise our hand, excuse ourselves, or ask a question, it happens immediately for us. The impulse goes to the hand. It raises from the brain controls our hand. For example, you wanted to have tea. Reach for the cup, it's hot, you burn your hand, and pull it back. It's also an impulse from pain receptors. Temperature went like this. The brain processed this information and understood that you need to pull your hand back so as not to injure the tissues of the hand. And it also happens that it gets stuck. This is a reflex at the level of the spinal cord, but this is difficult. Forget about this. So friends, it is important for us that our brain is a repository of information of your entire life. Here, everything you know, the alphabet, the multiplication table, where the money is hidden, everything is here, inside the brain. It controls your entire body, but it controls it through the connection, so it needs to connect with everything. What ensures the connection of the brain with our body? Spinal cord. The spinal cord is the body's wiring system. Nerves run from the brain to all parts of our body like wires. First in the spinal cord, then they come out of the inner vertebral foramina. See these yellow ones here, do you see? Here they come out of the intervertebral foramina. These nerve roots join together in the plexus, then separate again into nerves and spread throughout the body. There are motor nerves that are responsible for moving our hands, legs. We want to go somewhere, and we want to chase someone, catch up with someone. All of this is the motor part of our nervous system. Motor neurons, participants of nerves, they work like that. There are sensory ones. They distinguish different sensitivity. We touch something and understand what it is. Temperature sensitivity, heat-cold. Pain sensitivity, feeling the injections. Also proprioceptive sensitivity. Close your eyes, raise your hand, and you know where is your hand in space. We also feel it moving, even without looking at it. But all this is ensured by the hard work of the nervous system. Why does numbness occur? Because there is some kind of obstacle in the path of the nerve, specifically the sensory nerve. Our nerves pass through certain places, like tunnels between muscles. And these tunnel syndromes, this is the moment when the nerve is squeezed between 2 or 3 muscles, or some kind of formation in the form of a ligament. That is, here the nerve passes, for example, here is one muscle, here is the second muscle, and between them here is where the nerve passes. And for some reason, let's say muscle shortening, or hypertrophy of the excess muscle developed. Or for example, we have a bone here, and above this bone the muscle is located here, and between them is also a nerve. The muscle shortened, pinching the nerve. As a rule, it's not just one nerve that passes through, but together with vessels, that is, there is often a vessel with a nerve bundle. It's a vein, an artery, and a nerve. This often happens in the case of the pectoralis minor muscle, the scalene muscle. So, friends, let's get back to our issue. Why does the hand go numb? How dangerous is this? What will happen in the future if nothing is done? There are several levels where nerves intersect which go to our fingers. There are 3 nerves, median, ulnar, and radial. And the first level where they intersect, and because of which the impulse is disrupted and a feeling of numbness in the hand arises, is the scalene muscles. The muscles that are right here, in front and to the side of the neck. There are 3 scalene muscles: anterior, middle, and posterior. The second level is the minor pectoral muscle. It's located right here. From the coracoid process of the scapula to the 3 ribs, this is where it goes. 3rd, 4th, 5th ribs. What is it doing? It should work during breathing to stabilize the blade, but it shortens because either the chest muscle weakens or the blades are displaced like this. And the third reason why our hand may be numb is the very muscles of the forearm. Here they are often strongly shortened, strained, or here, which is called the posterior carpal canal. It is also very often squeezed due to the overload of this place, the consequences of inflammatory processes. And being in some position for a long time, for example, like this, that is, for example, you're typing, and you can also damage this place here. So friends, what to do? What should we do? Here are these 3 levels where our nerve gets pinched. We need to restore the nerve, release it on all 3 levels. Let's start with the small chest muscle. The small chest muscle is prone to shortening. To remove this shortening, we need to shift the load to the muscles here, right here at the back, between the shoulder blades. We need to make them stronger. To make them stronger, this exercise will help. So, friends, sit down if you are still lying down. We put our hands here, and now we connect the paddles. Maximally connect as if a $10,000 bill was placed between your paddles. And if it falls, then you won't get it. And then relax. Again, connect the paddles and relax. Connect and relax. So we do this 10 times, 10 repetitions. Then we put our hands here, connect our hands forward. I'll turn around and I'll also show how it looks a bit later. You make a movement forward, stretch the muscles, and back. This one we also do 10 times. And the third one. Put your hands behind your head and do it like this. Elbows forward, elbows back, connecting the paddles. So, friends, I have now turned around. Look, this is the position. Here, elbows forward, connecting forearms, and connecting paddles. Putting your hands behind your back, again, elbows forward, and elbows back. You can do either 2 or 3 sets in each position 10 times. We gave a load on the muscles between the paddles to relax the small chest muscle. And now let's stretch the small chest muscle. For this, find a door frame. Put your hands at the level of the chest, at the level of the elbow, one leg forward, and push yourself forward so that your chest muscles feel the stretch. And again, push yourself forward, intensifying the stretch, and relax. Push and relax. One foot forward. Then switch, put the other foot forward. Do about 10 repetitions. Then place their hands at shoulder level. And the same thing. Go forward, push, stretch this muscle from one side and the other side. And the third position, raise your elbow above, place it at eye level, or you can go slightly higher. Stretch this muscle, feel the tension, and then relax. Stretch, relax, from one side and from the other side. So this is the movement we make, friends. We are done with the first level where our nerves that go to the hand are pinched. Now, the second one. Let's take it to relieve the load from the trapezius muscles. To start with, let's stretch it. To stretch it, you turn your head. For example, I need to stretch the right one, so I will turn my head to the left. I find my sternocleidomastoid muscle and its back edge, put my fingers on it, And now tilt my head to one side and the other side. My head is turned under 45 degrees, maintaining pressure on the trapezius muscle. I am pressing on it. It will feel hard. It's behind sternocleidomastoid muscle. I make a movement towards one ear, the other, and move my fingers a little higher, a little higher. Now the second movement. I make such a sliding movement down the very muscle to stretch its fascia. I glide over it but press at the same time. And thirdly, I combine these two movements. I make tilts to one side but not too quickly. The same thing on the other side. Repeat. If you feel numbness in fingers of one hand, most often it happens, with this side you feel that the stretch is maybe more painful. I am pressing and making the movements to both sides. And we need to give more load on those muscles that were the cause of the scalene muscle shortening. The first ones are the neck flexors. For this, we put our hands on the back of the head and make such a head movement. We look down, then we look forward, down, forward. Your hands are just here for weight. You don't press hard on them. Do it this way. If you've never done it, do 3 sets of 10 repetitions this way. You load the neck flexors this way. You can also train the neck flexors lying down. Put a pillow behind and press with the back of the head. This will work a little lower for you. The same muscle, the lower part of the neck flexors. And next, it's the sternocleidomastoid muscle. It also needs to be strengthened because when it's weak, the scalene muscles, they often shorten. It is trained in this way, lying down. You turn your head to the left to train the right muscle and start lifting. Lift the head, lower it, lift, lower. Here too, it depends on how much the muscle is developed. Here, if it's not difficult, you can do 10 to 15 repetitions and turn to another side to train both muscles. So, friends, that was our second one. The second level, these are the scalene muscles. And the third level, the forearm muscles. The tension of the forearm muscles very often is the cause of numbness of, for example, these 2 fingers, maybe 3 fingers or more. Well, in short, different options. It depends on which nerve is pinched. Elbow, radial, or median nerve. And here, take a small chair with a back, preferably smooth, but you can put something on it if there is a sharp corner here. Take your hand, put it on this chair. For a start, we'll just use the weight of the hand. And your task is to go through all these muscles and find the sore spots, massage them. That is, you work them out like we worked out the muscles with you with a ball. This part is more convenient to do with the back of the chair. Divide your forearm into several parts. Go through the middle, closer to the side of the thumb and closer to the side of the little finger. For example, if these 2 fingers are most often pinching the ulnar nerve, you need to work more with this part. You might even feel that when you find the place where your nerve is most compressed, the numbness can either decrease or increase when you press, or even more pain can go into the finger. It means this is exactly the place you need to act on. If the pain is strong, you press a little weaker. If the numbness goes away, continue to do the same. You can act on each point for up to a minute. If the pressure is not enough, you can strengthen it with your second hand like this. In this way, you work through all the forearm. Next, friends, these muscles, they are also prone to shortening. Therefore, they can be stretched, among other things. Look how it's done. Stand up to the wall. Put your hand like this on the wall. Feel. If there's tension here, put your hand lower. If there's no tension, go higher. And so find a position in which you feel this tension is less. You can even go up to the shoulder level. And in this way, stretch the muscle, relax, stretch, relax. The second option is when you do this on a table, for example, you can also put your hand and stretch in this way. That is, you stretch this part. At the same time, you can also work these muscles with the other hand, massage them. Also divide it into parts, closer to the thumb, closer to the little finger. And we've worked all this out. So, friends, we have restored the innervation of our hands. Now we are not afraid of the numbness. Now the strength of the muscles has increased because the impulse is already with greater force to the muscle. The sensitivity of the hands increases. Maybe your handwriting will become better and there will be no soup pouring out from your spoon. Well, friends,